Cardiac arrest can happen at any time to a victim of any age, on land or in the water. When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 6 actions that, when performed in rapid succession, increase a person's likelihood of surviving cardiac arrest. Each link in the cardiac chain of survival is critical, and all of the links are interconnected. There is a cardiac chain of survival for adults and one for children and infants. Let's take a look at the adult cardiac chain of survival. First, there is a recognition of the cardiac emergency and activation of the emergency response system. Then, early high-quality CPR, followed by early defibrillation, advanced life support, integrated post-cardiac arrest care, and recovery. Lifeguards and the other members of the safety team play a major role in completing the first 3 actions in the cardiac chain of survival. First, you recognize cardiac arrest and activate EMS.
Call 911, we have an unresponsive male!
This provides the victim with access to advanced life support as soon after arrest as possible. Next, you provide early, high-quality CPR as soon as you recognize cardiac arrest. CPR provided at the scene before EMS arrives circulates oxygen-rich blood to the brain and other vital organs, and may help to prevent brain damage and death. Third, you use an AED as soon as one is available. Using an AED at the scene prior to EMS arrival may restore an effective heart rhythm, increasing the person's chance for survival. The fourth link is early advanced life support, which is provided by EMS professionals at the scene and on the way to the hospital. The fifth link is integrated post-cardiac arrest care. After return of spontaneous circulation, or ROSC, survival outcomes are improved when healthcare providers work to stabilize the person, minimize complications, and diagnose and treat the underlying cause. The sixth and final link is recovery. Continued follow-up during the recovery process in the form of rehabilitation, therapy, and support from family and healthcare providers improves outcomes. The pediatric cardiac chain of survival is slightly different from the adult cardiac chain of survival. Because cardiac arrest in children often occurs as the result of a preventable injury, such as drowning, prevention is the first link in the pediatric cardiac chain of survival. The second link is recognition of the cardiac emergency and activation of the emergency response system. And the third link is early, high-quality CPR. The fourth link is pediatric advanced life support. Just as in the adult cardiac chain of survival, integrated post-cardiac arrest care and recovery are the last 2 links. As a lifeguard, you play a vital role in implementing the first 3 links in both the adult and pediatric cardiac chains of survival. In cardiac arrest, when every second counts, your actions can make the difference between life and death.